everyone, thanks for tuning in. Today I'm going to be chatting to some of the healthcare heroes of the NHS. If you have had cancer, you will have encountered a cancer clinical nurse specialist or Macmillan nurse. They are indispensable to cancer care. But what do they do for the service and what do they do for our patients? Today I'm talking to three colleagues from Manchester, Emma Garth, Jenny Pearce and Karen Donnelly. Ladies, welcome. Thank you so much for joining me today. I am so excited to speak to you and to have a peek behind the scenes of the work that you do. Welcome.
Hi.
Thank you.
Thank you for having me.
So let's start with the basics. Is a cancer clinical nurse specialist the same as what people will have heard about a Macmillan nurse? Is it the same thing or is there a difference?
So I think that's fair to say there is loads of different types of Macmillan nurses out there. It's a huge breadth of the nursing profession, which covers everything from our role to end-of-life care in the community to coordinating care. It's another one of those wonderful nursing professions where we overlap lots of different aspects of cancer care. So I suppose our role is based in hospitals. We are there from the moment someone gets diagnosed throughout all their journey, in whatever aspect the end of that journey may be, whether it's discharge, whether moving to another area, whether it's the end of their life. We will be present for all of their in-hospital support, meeting their consultants and being their sort of point of care for any questions or concerns or just for a bit of a chat. I think that's my understanding of our role. Emma?
Yeah, I'm relatively new to the role, so I'm still learning every single day, as we all are probably. But I think sometimes people think Macmillan nurses are just, they come to your house, they're more based in the community. But no, As Jenny said, we do that role just hospital-based, and we offer a lot of support toward, directing people to offer the support that Macmillan can offer.
Okay. And can you give us an idea what a typical day in your life at work is like? Hectic, I know, but just could you give people an idea exactly what you do?
Yes, very, very hectic. Every day is different. You never quite know what you're going to be doing that day, but that's part of what I love about the job. So some of the main things that will happen every day is one of us joins the gynecology oncology ward round on our ward based at St Mary's Hospital, and that's where we will go and visit all of our post-operative patients, seeing how they are, getting an update from them. Do they need anything from us, urgently? Are they going to be discharged soon? If they are, we will go and see them, make sure they're happy with everything that's happened so far, offer them post-operative advice and things to look out for on discharge. We may then offer some support visits to someone who's recently had some bad news, perhaps. So we will go back to the office and have a huddle, really, like a handover, and make sure that all the urgent visits are delegated to people. Then we might have emails to answer, telephone calls to return. Then we might have some clinic appointments where we are with the consultants down in the outpatients department, meeting new patients, introducing our service and what we do. After that, of course, always the paperwork. So we write up all of our interactions with our patients. It's important that's all documented correctly. We may then also do onward referrals to different support services. Jenny, I'm sure there's more things.
So another big role is anyone who's dealt with cancer has probably heard of the multidisciplinary team. So this is, if you have had a diagnosis, your case will be regularly discussed by a team of professionals. This will be everything from surgeons to people that give chemotherapy, people that give radiotherapy, the radiographers that look at the scans, the pathologists that look at any biopsies, and obviously the specialist nurses. And they all meet and discuss to make sure that regularly a team of professionals are looking at the best possible care for our patients. We as CNSs also sit in that meeting and make sure that the needs, the wants, the hopes of a patient are part of that discussion and that they're properly represented. We also play a major part in sort of feeding that information back to the patients as well in the way that they need, that would be most helpful for them. But I think, as well as all those systematic jobs, our main role is being the key worker for the patient. So if you've got any questions or concerns, you can just call us up. If we don't know the answer, we'll find someone that does. We'll make sure you get the information you need, or at least try to.
And certainly in my experience, you also kind of form a bridge. So if I have a patient in my benign gynecology clinic, I'm not part of the cancer team, but if I've got a patient who I'm delivering a diagnosis that in my investigations we've diagnosed cancer, one of you guys come to the clinic with me, sit in with the appointment, the consultation, and you then take the patient off after for a bit of a debrief to explain what the service, to explain what to expect. And I think that's really, really important in healthcare. I keep saying it, that a big barrier to healthcare, a big part of the anxiety is not knowing what to expect. And you just provide an amazing like transition into the cancer services by explaining to patients, giving them contact details so that they've got you as a contact as well for the team, and to know what to expect and kind of what happens next.
Yeah, and that's the bit I really enjoy. It sounds really daft. It's really hard to go through cancer, and I think the worst part is the not knowing.
Yeah,
you're constantly got these scans, these tests that have been happening to you, and what comes next? You're thrown into a world where it's really scary and you've got no experience, and people are using all this language which is very concerning and you've never heard before, except for maybe a poorly relative. And I really enjoy being the person that's able to go, actually, this is what this means. What does this mean to you? How can we make this even remotely more manageable for you?
Yeah.
So
I think you hear that C word, don't you? And everything after, anything said after that word is often just not taken in. It's a blur. It's, sometimes people don't have anyone with them in the consultation. So I think, we're really important, like I say, to bridge that gap, really, that they're not just going to get sent home now, and the plan, there's someone they can speak to. And like you say, we can guide them on the rest of the pathway, which, like you say, can be very complicated and things. But I think that sort of fog that people go into once they hear that word, it's very important to acknowledge that and that is okay and that's normal. But a few days, a week later, we can reconnect and try and make sure everything is understood and that they know what's going to happen next.
Okay. And Jenny, you mentioned that that's one of your favourite parts of the job. Can you let us know what is it that attracted you to this role in the first place? It's as if sometimes you start a role and you think, oh, I really like this part of the job, but what made you go into it? Can you tell us what inspired you?
So I've done a couple of different roles in the NHS so far, but I like talking to people. I like problem solving. I enjoy making a difference, and this job is 100% that. We get to form what I call a therapeutic relationship with our patients, and we get to know them. We follow them. Some people it's for days or months. Some people it's for years. And being able to get to know someone, try and tailor things for them, try and make this world a bit better. I enjoy having that communication. I enjoy just making a really awful situation just a little bit better for someone, and being the person where someone can ring and go, this made no sense. What is going on? And I go, I'll see what I can do about that. I find that really satisfying. And it isn't just the patients, it's also the staff. I think an aspect of our role we haven't discussed is also the role we play in the greater multidisciplinary team. We spend a lot of time doing training and coordinating with our colleagues. We take part in research projects to make sure that we are on the cutting edge of cancer care. We do a lot of work towards that. I know Karen sits in an awful lot of meetings to make sure that we've got the most current research. We are doing the absolute best for our patient at all time, coordinating with people from different countries to make sure that we are taking in the best practice. That's another big part of our role, being part of these cancer panels and Manchester overviews, listening to what's happening, optimizing our care, and bringing that back to the ground floor of cancer care is another massive role of the specialist nurses, and actually making that action for our patients. That's a big part, and it's that coordination, it's that networking. I suppose that's also a joy. I like having the knowledge. I'm interested in cancer. I'm interested in making our services as best as they can be. So being a CNS gives you that role, gives you that autonomy to go, actually, I'd like to make things better all the time, improve.
Okay. And Emma, what drew you in?
Yeah, so quite similar, really. I've a lot of my past roles have been where I don't spend that much time with one patient. You know, I worked in surgery, so you're getting them ready for surgery, and then off they go and have their surgery, or outpatient environments. And I always missed that. I never really knew what happened to them. You know, I never sort of knew their outcomes and what the rest of their pathway was like. So that was one of the main draws for me, is that I can really, like Jenny says, get to know people, and I just feel like I can make that bit more of a difference and by following them through and taking on their journey. But yeah, it was that really, just to be able to, like you say, get to know our patients and tailor things for them, rather than just sort of seeing them for a day and then that's it. I never knew what happened.
Karen, do you want to add anything?
Hi, yeah, well, the girls have covered nearly everything there.
True.
I feel having the opportunity, having been a nurse specialist, I'm line managing them at the moment, but I feel it's a real privilege to work with patients who are at a very vulnerable point in their lives, and to be able to offer some sort of support and help is, you know, very job rewarding for us, but hopefully makes a difference to the patients. And listening to the feedback, there's now National Cancer Patient Surveys. We try year on year to improve the care that we're given and work on things that maybe aren't so good. We all work in the NHS and our resources are low, but we try really hard to make a better experience. And you asked the question initially, is there a difference between Macmillan nurse and a cancer nurse specialist? Not really. It's the same role, but some roles would be funded initially by Macmillan or Macmillan adopted, but both roles aim to give the best care for patients and their relatives, and looking at their holistic needs assessment, what's important for them, and seeing if we can devise a personal care plan for them. Yeah.
Okay. And you kind of all have mentioned that you have worked in different roles in the NHS before this. What roles have you worked in, and how do you think those roles may have prepared you for the big responsibilities you hold now as clinical nurse specialists?
So I'm going to be honest, I've done a lot of jobs in my life. I didn't come straight into nursing. I spent a lot of time running a bar for a long period of time, which I think really did prepare me quite well for being a specialist nurse. Being able to talk to people of all walks of life, being able to just listen. That's a big one, listening. And then as a nurse, I spent a lot of time in surgery. So I've done a bit of time as heart and lung surgery. I was a sister at the Christie doing general oncology surgery. And one of my favourite points in that is just night shifts. I really, really loved working a night shift, working with some of our breast care patients where you have to be there every 15 minutes to check on like a flap or a very particular challenging wound, and just sitting up and chatting and providing a more human face to the really inhuman things which are happening to someone. So that kind of led me into being a specialist nurse. I originally joined the NHS thinking I'd work in A&E. I was wrong.
Yeah, quite different, isn't it, what you do now? And that is a special skill. Being able to listen is a skill. and being able to chat and just, not necessarily talk always about the thing that you need to be said, but to talk around it. And that just helps to put people at ease. So, these are all special skills that we just gain through our lifetime by doing different things. Emma, do you want to tell us what
Yes,
you were
so
doing before?
I'm relatively new to nursing. I came into it sort of in my 40s, so later on in life. So I did a lot of different jobs as well, management roles. Again, everything that you learn in your past, jobs is relevant to this role. We have to do so much, time management is important, delegating, prioritising, deadlines and things. So I feel that those skills I've sort of carried through really. But then in my nursing roles, a bit like I said before, I worked in a day case unit, so that was sort of lots of patients every single day, different patients. And then I also worked at the Christie, delivering chemotherapy to gynecological cancer patients. So that is the role really that sort of piqued my interest in coming into the world of oncology. So yeah, I'm very grateful for that role. But yeah, I think that's what it was really. Just again, I was only seeing a small part of their journey, just delivering
Yes.
their chemotherapy. But yeah, it was that really sparked my interest in wanting to develop into the next role really on the oncology pathway.
And I guess you can use so many of these skills in your role now. So being in surgery, being in theatre, you can kind of reflect. So you know what it's like. So you can kind of discuss with patients, delivering chemotherapy. It's such a good uh, field area to go into when you've had a kind of broader experience, because you bring that to the role. And I think patients realize that and they appreciate that you're not just talking about what you've read. You're talking about where you've worked and what you've done. Karen, tell us what you've done before.
So my background was in surgery, started off in general surgery and then moved to gynecology, moved temporarily because I preferred looking after men. And then I've been here for 30 odd years. And I worked in London in a big unit that delivered gynae oncology management. And I think that's where my interest grew. And then I was fortunate enough to be the first gynecology Macmillan CNS in Manchester,
Wow.
and set up a service and made the job up as I went along. But I'm very proud of the team that we've got now. They're fantastic. They come from different walks of life, different fields of medicine and nursing, and bring an awful lot. So we've got different members that have particular interests, be that fertility, the menopause side of things, palliative care, pain management, delivery of the ovarian cancer pathway. So it's great
Sexual health.
to have such a wealth of knowledge, and such a fabulous team that are now covering cross sites for the whole of Manchester Foundation Trust, which, as you know, it includes North Manchester, Wythenshawe, Withington, Trafford, MRI and St Mary's. So it's a big patch, and obviously liaise with the community side of things as well. So my career then went into advanced practice. So I look at that side of things within gynae oncology as well. So I think that all the roles together, we try to provide a very high standard service for our patients.
Yeah, and you absolutely do. And I can confess now that I described you at the top as some superheroes of the NHS, and I certainly am a super fan of what you guys do day in, day out. The care, the empathy that you deliver to patients and their families. I mean, it's absolutely amazing. It's astounding and it's inspirational. So thank you for everything you do. But I digress. So you're making this role sound really busy, which I know it is, but you're also making it sound really rewarding. And you're also making it sound like a role in which you can be yourself and you can bring to the role all the skills, experience that you have had in life, otherwise in other roles, to the benefit of those around you. And by those around you, I mean patients, families, colleagues as well. And we all appreciate you. We think you do an amazing job. So tell us, for people who might be interested in going into this role themselves, what kind of person do you think would suit this role and be happy in the role and thrive in it? As I imagine it can be very demanding in several ways.
I think you've got to be able to listen.
Yeah.
You've really got to have the ability to sit down with someone and listen to what they say, even if you don't 100% agree with it. If you're coming into this role being the sort of person that's there to impart knowledge, you're going to come across an awful lot of frustrations very, very quickly, because everyone's values, everyone's thoughts, everyone's brains are different. And if you're coming here just to go, well, I'm going to tell people about chemotherapy, I'm going to tell someone about surgery, you're going to have a hard time, because, as Emma said, when someone hears the word cancer, their brain shuts off. They're going to automatically think of what their kid's going to do without you, what they're terrified of anesthetics, what's going to happen to their parrot when they have to have surgery. They're not going to be that interested in what you're going to say about not lifting something or not having sex for 6 weeks. So you've got to be able to listen to someone else. That's the key skill. That and the ability to learn. You've got to want to learn, because it's always changing. Apart from that, you can pretty much wing it.
Okay, so you guys are making this role sound very busy, which is true, I know, but also very interesting and very rewarding. For those who may be inspired to come into this role, what type of person do you think would suit this role? And what do you think would make people thrive in the role and be happy in it? Because I'm sure, despite how enthusiastic you are all and committed you are all, I'm sure that this role is challenging in many ways.
So I kind of think you need two things to sort of thrive and be happy in this role. First of all, you need the ability to listen. I think that's most important. The second is to be able to roll with change and be adaptable. So in terms of listening, every patient will be different. You need to be able to sit with people, listen to their news, even if it's not something you agree with, not if it's something you feel comfortable with. Everyone is going to react to a cancer diagnosis differently. You're meeting someone at the worst possible time in their lives.
Yeah.
And you've got to be able to listen to what they're saying, adapt your information to that, and be able to try and make this as comfortable for them as possible. And you can only do that by learning what your patient needs. And adaptable, because this role is always changing. There is always a new challenge. Something is always slightly off. Nothing is standard. Everything needs that little bit of tweaking. There's always new evidence coming through. So you need to be able to roll with that change and be comfortable with that change, or you're going to find this quite an overwhelming role. Yeah.
And I ascribe very much to a growth mindset, in that we maybe can learn things, we can learn parts of our personalities and develop parts of our personalities, and sometimes working in a team can help develop that side of our personalities that is relevant. Do you think this is a role that someone can grow into, learn from, and actually maybe become a person that they never knew they had inside?
100%, and I am that person.
Right.
I am 100% that person. We work in a team of 9 specialist nurses, and each of us brings something very different to the role.
Yeah.
And I have learned such patience and such a sense of calm, which I, as a person, me as a 20-year-old, would have never even had a concept that I could possess. I'm a little bit of a slightly dramatic personality, and I have learned from my colleagues, from my patients, just a whole different side of myself that I thought I never. And I'm going to be a different person in a couple of years' time. it's one of the another amazing part of this job. You will change, you will grow, and I can only think it's for the better.
Yeah.
Emma, you're quite new to this.
Yeah, that's what I was going to say, really. Obviously, I'm only 6-7 months into this role, so, a long, long way to go. But even now, I've already noticed, I feel, I don't know, a different confidence, or that what I'm doing is really making a difference. You get feedback, obviously, from our patients as well, which does, it's lovely to hear that you have made that difference on someone's, can be a terrible journey. So that is really, it's a nice boost, isn't it? Everyone likes to hear some praise. Unfortunately, the NHS, we don't often hear that side. It's always the doom and gloom and the bad stories, really, that get all the press. But I think even if you can make that difference to one person, then that's such, like Karen said, fulfillment in our role. But I'm a learner, so I'm just really excited to keep learning, keep taking on new knowledge every day. I'm always asking questions, what's this, what's that? And like Jenny said, we have such a brilliant team with a depth of knowledge that I do get that brilliant support from my peers and my colleagues. So yeah, definitely something that I think you need to be someone who wants to go that extra mile, and really become passionate about their job, because I think that's so important in our role about, doing the extra mile for our patients.
Okay, and you, in answer to my previous questions, have demonstrated beautifully today that you can come to this role via different avenues or different paths. What experience or qualifications do you think are necessary to take on this role? Can you advise other people?
I think you need some experience in oncology.
Yeah.
If you're interested in this kind of role, you get onto an oncology ward, work in outpatients, have some sort of exposure to oncology so you can experience it. It's very different reading into a book how you would talk to someone with cancer than doing it routinely. You want to be making sure that you've got some concept of what you're coming into, because it's very different. It's not about knowing how to comfort someone when they're sad. It's being able to roll with every single emotion, and your only way you can learn that is through experience. So I think the key thing you need to step into this role is some experience of that journey, in whichever way that is, whether that's supporting family members, supporting it through an NHS role. You need exposure to that whole different world.
And qualifications? Can any nurse become a CNS?
Yeah, so I came from a more traditional role where you worked oncology roles, you worked within a band 6, you had some teaching qualifications, which are more desirable. You need to be able to impart knowledge, and then applied through. I did a secondment from someone's maternity leave, so I had an idea of the job and then got my full-time post. That is normally the sort of things that they're looking for on a job application. But Emma, you're the exception to that rule, aren't you?
I am a little bit, yeah. So I suppose, yeah, like Jenny said, I have the oncology background at the Christie, but I also think it's about the type of person you are as well, and how that comes across. I always believe you can't teach empathy, can you? I think it's one of those things that you either have it or you don't. So yeah, I like to think that it's a mixture of your personal your characteristics as well that are almost as important as the medical background or the educational background.
Okay.
Karen, you're the one that's hiring us.
Yeah.
Yeah. Everything that you both said. Obviously, you have to be a registered nurse and you need to be a graduate nurse. Ideally, with a passion for oncology patient care. But we have had members come in with a women's health background only, or a palliative care background. Which, again, if there are transferable skills that are seen when the person's interviewed, then obviously we'll bear that in mind. It's, some people have worked in different long-term chronic conditions and have an understanding of the implication and the impact that that has on the person and the family. So all of that we would bear in mind. We're looking for a person that's going to be an advocate for the patients, who's not afraid to speak up, who's keen to learn, because I've been doing this role in oncology in various roles for a long time, but I learn every day. I'm still learning. There's always something. So yes, we want people with passion and enthusiasm and compassion to become part of the team and to add to this ever expanding team that we need.
Okay, great. And you are all very passionate, and it comes across. You're all excellent communicators, which I'm sure, is an integral part of the day job. But just to look inside yourself now and let us know, what is it that you like about your job? What is the thing about your job that keeps you in it, that keeps you passionate, that keeps you enthusiastic, that keeps you coming to work every day in, day out, supporting our patients and their families?
Caffeine keeps me coming back to work every day. I'm very, very caffeinated. No, it's the patients every time. I love talking to people. I love crying with people. I love spending time trying to make things better. And this job means that day in, day out, no matter how angry or stressed or overwhelmed I can be, you step into this job and you realise that it ain't nothing. Like, there's nothing in my life that can overtake some of those moments that people are living through, some of the decisions they have to make. It keeps you really, really humble and really grounded, because you're supporting people fighting one of the hardest fights, and they keep going, and they still crack a joke, and they still sit down and chat to me and go, do you know what, let's have that coffee. And you go, hell yeah. And I love that. I love that connection. And even if you're shouting at me over the phone going, how dare you, I can't do this anymore, I can then pick up the phone a couple hours later and we can make some progress. I love that connection. I love my patients.
Karen?
What keeps me coming in and loving my job? The patient groups that we work with, and yes, like we've said before, how that keeps us grounded and makes us realise, that our problems often are little really in compared to what people are going through. But also our peers that we work with every day, both nursing and medical and admin peers, and just seeing a team really working together, working really, really hard in difficult times, trying to make a cancer pathway work in favour of the patient, to try and have earlier diagnosis, earlier treatments and better outcomes. And we all know that it's not always, we can't always have that best outcome. And so in those difficult times where treatment is no longer an option, that we can make the palliative care side of things for patients and end of life side for patients and their families as best that we can in a very difficult time.
Emma?
I love to be able to take away, the little stresses in their life, the little things that I can help, that to them might be a huge drama, but we know that we can, help direct them to that GP, speak to that GP, get that prescription done, get that scan done quicker, get their results done quicker. I think working in the background is a lot of what we do. We're ringing radiology, I need this patient to have a biopsy. But really, that's the thing for me, is trying to be a cog in the machine as well, move everything along and try and keep as much stress away from the patient as possible, because they're already going through a terrible time. So it's being able to be that person in the background really, to make everything run smoothly, and just being able to make a difference to them along their pathway.
I think Emma spent at least an hour camped out in radiology the other day just to try and get a
Oh,
drainage.
they lovely.
Like, she wasn't leaving until she had that date. It was impressive to watch.
Wonderful. Now, you've all demonstrated so clearly to us and so movingly how committed you are to this job, to your patients, to the pathways, to your colleagues, and how much you give of yourself to look after our patients. My next question is, how do you look after yourself? Because this job must be physically demanding, demanding of your time, and demanding emotionally. And we all say we've got to look after ourselves first before we can look after other people. But we don't always in healthcare do that. We always put patients first, don't we? So can you give us an idea of what you do to look after yourself, having such an emotionally particularly demanding job?
I would say we talk. We talk a lot. We talk a lot in the office with the rest of our colleagues about if there's a particularly difficult case, patient that we're looking after. We are very, very good at sounding off to each other, having a hug, get a cup of tea. We all love a cup of tea, don't we? But we also have supervision time as well with one of the lovely Macmillan counselling team. So once a month she comes and we allocate a time slot there with her. So that's really useful to just, if we've got someone that, we're just not quite sure how to best support her, she can really be really helpful in signposting or giving us some ideas and hints and tips about how to best support her. So yes, lots and lots of talking.
Anyone else?
I do martial arts, which always helps. There's nothing more soothing about kicking something hard and then meditating about it afterwards.
Right.
So, making sure you've got the work-life balance.
Yeah.
It's very easy to take this kind of job home for you.
Yeah.
There is no end to the job. So I think it's quite normal for us to leave late, and that's something we're working on to make sure you've got that balance. It's very hard to prioritize going home or eating your lunch and not doing that at your desk when it's someone's distress, someone's pain, which is you're wanting to try and even make a dent in. So work-life balance is really important to maintain in this job. And so for me, that's doing my martial arts and looking after myself physically. And Kathy.
Okay, so it's good to know that although you are the support for patients, that there is also support for you. So if there were anyone who might be interested again in this role, because that might be why people have chosen to watch this podcast, that they're not going to be on their own having to carry this burden, that there are people around them to support them and to help grow into the job. Do you agree with that statement?
Absolutely.
Definitely. I think being part of a big team does help because you have got different people to bounce concerns with, hopefully your manager as well. But I think it is important to feel that you're not going to be left with all these concerns going home yourself. It's really important to share it and some of the decision making, because some of the discussions are really challenging and difficult, and sometimes it's about techniques, about managing it, about putting it onto a more senior member of the team if you feel like it's beyond your scope, or thinking about personally if there's things going on in one of the clinical nurse specialists' lives that could affect their work, trying to avoid certain areas on certain days, a temporary time. We try to look out for everybody.
Okay. So you guys deal all the time with patients who have been given a cancer diagnosis and hold their hands through the journey. Given the opportunity, what would you say to patients and families who have been diagnosed with cancer. And also, as I said, some people may look at this podcast, which is, in my view, inspirational, nothing short of that, and think, actually, that's what I want to do. Given the opportunity, what would you say to them? So first of all, what would you say to patients and families? Jenny?
If you've got cancer, when you're going through hell, keep going. Have a look at what you are aiming towards. What means most to you? Talk to us, tell us, let us aim for that with you. It's so hard to think past the first couple of days, the first couple of weeks. But it's a long journey, and it's an endurance journey. So pace yourself, listen to your body, and tell us what you need. If we can help, we will. And if we can't help, we will signpost you. But look forward. Always look forward. Keep going.
Okay. Emma?
Yeah, I think very similar, obviously, but it's having that hope, that positive mental attitude. I do believe is so important, and take one step at a time. Really, I think that's what I say to a lot of my patients. It's a long road but you need to sort of break it down really into what's next, what will then happen, and I think that's really important. I do feel like that probably makes it a little bit easier to handle, mentally and emotionally, rather than getting too overwhelmed with everything that may be to come, but we don't know for definite yet. The what ifs are often the hardest thing. We do find that people are have a lot of anxiety in that wait for the biopsy result to come back. So, we talk about distraction techniques and things as well. But yeah, I think the big thing for me is let's just take it one step at a time, try and break it down. But yeah, have hope.
Karen?
Yeah, definitely agree with what Jenny and Emma have said. I think that for patients, it's seeing what's mainly concerning them, like I spoke before. If they're worried that they're going to lose their job and finance is an issue, or their relationship, their children, what's going to happen, their roles changing, trying to help them through that and signpost them to the help that they need, be that Macmillan benefits or some emotional, psychological support. And trying to, by alleviating those worries, hopefully they can concentrate more on what's coming next with their investigations and treatment. But like Emma said, trying to inspire hope where we can, and work through with them, and having that option that they can come back to the CNS team as well, at any point along the journey.
Okay, so I guess I can summarize that to say the message to patients and families are, we are here for you and we will always be here for you. I think that's what I'm getting, and it's a powerful message. And what of these very keen, enthusiastic nurses who are currently in A&E, or they're currently in the community, or they're currently doing whatever they're doing, and doing a fantastic, having a fantastic time doing it and doing good work. But then they think, hang on, maybe I want to work in cancer. Maybe I want to be the person that provides support and holds hands, and I'm empathetic and I can listen, and I want to learn more. What would you say to them?
Come and shadow us. Come, call
Great.
us. Come see what we do. See if this is the right path for you. It does take a certain level of insight, so come and see what we actually do. Try that as a common post. Dip your toe in the waters and come and experience it. We'd love to have you. And we can probably learn from you as you can learn from us. We're always learning. So yeah, come and join us. Come and visit. Yeah.
That's a great offer.
Yeah, exactly what I was going to say. Please come and see us. We're always happy to talk. If you just want to, especially I'm a new to the role as well. I can offer some insight. But yeah, please come and see us. We're a lovely bunch.
I can attest to that. Okay, so Karen?
I think also if you've not got that opportunity to spend a day with a CNS, perhaps if you work in an outpatient department or even on a ward department, try and listen in to some of the consultations that take place, which you wouldn't normally listen into if you've got permission from your management. Often the breaking of difficult news, etc., and then what happens next to the patient, because you don't always get that opportunity to witness what happens with that. And I think gives you some insight into what the role's about.
Yeah, great advice. Okay, well, there only remains for me to thank you for joining me today. It has been wonderful talking with you all. It's been fantastic and fabulous to have a bit more information myself about what you do and what happens behind the scenes. I'm sure this video will be really, really well received because it's full of information, and most of all, it is full of hope. Thank you so much for joining me today. And most of all, thank you for your unending commitment to patients and their families and your unending work in cancer care. Thank you so much.
Thank you for having
Thank you.
us. Thank you for listening.